Well, good morning. 1027 and 1035 WICY, your feel good tunes of the 80s and more. It's John Kazar. On a Wednesday, 9:40, we are joined by those from Hyde Medical Center, Dr. Not Todd Whitman. It's Matt Jones, Matt, can you explain your role with Hyde? There's a few different, titles we can give you, right?
Yeah, no, I'm the Senior Vice President and Chief Operating Officer at Hyde. So kind of on a daily basis, I oversee the operational pieces of the organization.
Yeah, and I'm sure even the last 3 or 4 months you've had your work cut out for you, right?
There's been, to say the least, there's been a lot going on over the last couple of months. A lot of work, a lot of great work going on with the staff and employees at Hyde and also in the community.
Yeah, and here's a big reopening update, your dental center.
Yeah, our dental center, we're looking at phasing in a reopening of our dental center. We actually opened up about 2 weeks ago. We're starting to do some dental care for pediatric patients. And the reason why we've opened it up for pediatric patients is right now we're able to do teeth cleaning with them and hand scaling and stuff like that really doesn't produce any aerosolizing droplets. And right now, COVID is actually thought of to, at times, be able to spread through aerosolized procedures and droplets. So we're trying to limit the amount of airborne procedures that we're doing, which will help keep not only the patient safe, but also our staff safe as well.
Yeah, no, it's what we have to do here. And something else we have to do, even through what we're hearing is decent news as far as a decline in cases, is to continue to remain vigilant, Matt.
Absolutely. Our region of New York State has done a great job. We've been very fortunate with the way that we've been keeping our numbers down in our region, compared to some other places in the state and also what's happening throughout the country right now. So, a lot of the work that's being done not only in our organization but throughout the community in our region has done a great job with keeping those numbers down. A lot of that comes down to really observing the social distancing. Wearing masks, good hand hygiene, and good respiratory hygiene are all pieces that really help us keep those numbers down. As community businesses start to open back up, there's been a lot of work that's being done, a lot of great work that's being done throughout the community and the region to really try to keep those numbers down. And, my hope is that we can continue to flatten the curve and keep doing what we're doing to keep everybody safe and healthy.
That's the goal, man. And, some folks may need a little refresher or clarification on the limitations of your visitor policy. If you don't mind going into that, Matt.
Yeah, so we opened up again, I think it was probably about 2 weeks ago, where we were able to open up some visitation hours at the hospital. And before that, we weren't able to. There was an executive order, which is almost like a law that was put out by Governor Cuomo, that restricted hospitals from really having any visitors in the hospitals. So 2 weeks ago, we were able to open it up. I believe the new executive order that came out said we could have 4 hours of visitor time at the hospital for our inpatients. So currently right now we have visiting hours that are open from 12 to 2, and then we also have them open from 5 to 7. And what we wanted to do is we wanted to spread out those 4 hours a little bit. Mm-hmm. Sometimes for some visitors that might be working and don't have time to see their loved ones or friends during the middle of the day, so we opened up some hours at night as well. It's going really well. We are definitely getting people in and out as we can, and the patients like it, and the visitors obviously love seeing their loved ones.
Oh, man, it's very important, and I know you've been trying your best to accommodate, the needs for everyone here, but it's a very unique situation, Matt, so I just want to say thank you for all you've done.
Yeah, absolutely, and just one more thing I just wanted to make sure I pointed out right now, we still, again, through the executive order by the governor, are still unable to have visitors at our skilled nursing facility and the assisted living facility, but we're continuing to keep our eyes open to see if there's any new guidance that comes out on that.
Okay, that's great. Matt, we'll probably speak in a couple of weeks. We'll have Todd next week, it's looking like, but either way, we enjoy having you on here, okay?
Absolutely, appreciate it.
All right, it is Inside the Community with those from Hyde Medical Center getting updates every single week, and we've liked what we've heard so far as we continue to edge forward here on 102.7 and 103.5 WICY.